Age-related macular degeneration is a very common condition. It's the leading cause of blindness in the United States and the Western world. And in states like Oregon and in countries like the United Kingdom, where studies have been done, more people have been reported as being legally blind with macular degeneration than all other causes combined. So over the years, it's become a very important area for us to focus on in terms of finding new treatments and learning more about the disease. The disease itself starts with a situation in which drusen, which are little deposits, form in the macula, in the back of the eye. These are little yellow spots containing fats, which over a period of years, once we reach middle age, start developing, and actually to some degree in every one of us. We all have these tiny deposits. That doesn't mean we have macular degeneration, however. So if an eye doctor were to look into your eye and see that, that doesn't necessarily mean that you're in danger of losing vision from macular degeneration. However, we do have certain criteria, size and amount, where if an individual has developed enough of these deposits, then we know they're at risk for losing vision later on. Doesn't mean it's necessarily going to happen, but it can. That is considered dry macular degeneration. These drusen deposits, starting in people generally over the age of 50, once they reach a certain size, that's considered dry macular degeneration. No vision loss, not even aware they're there unless you're told that they're there. If you're over 65, the chances of you having this kind of macular degeneration, the early type without symptoms, are probably a little over 20%. So maybe 1 out of every 4 or 5 people over the age of 65 will have some of these deposits, which we consider significant by the virtue of their size and amount. Now, these people do not lose vision, but the more advanced macular degeneration, when it occurs, does cause central vision loss. And there are 2 types of these advanced forms. One is wet and one is dry. About 5–6% of people over the age of 65 will have one of those 2 forms. And these are people who've actually lost vision and are losing vision from macular degeneration. It's a more advanced stage. The dry form is where cells drop out and form atrophy in the center of the back of your eye. And there's a name for it. It's called geographic atrophy. The wet form is the form where new blood vessels grow in behind the macula in the back of the eye, and they leak and bleed and form a scar right in the center, so that it causes difficulty in seeing straight ahead. Both of those are about equally common. The wet form tends to be more dramatic and more serious because it can happen literally overnight. A blood vessel can burst and you can have a hemorrhage. Usually it comes on over a period of days or weeks, sometimes months. The dry form, on the other hand, the advanced dry form, the atrophy form, really progresses very, very slowly, where you might lose a line on the vision chart every year over a period of time. However, it can also, over that period of time, lead to legal blindness and very severe loss of sight, but on a more gradual basis. So those are the 2 forms that people refer to when they talk about wet and dry. I should mention also that the macula is the very special area of the retina which is responsible for central vision. The retina is the very thin layer which lines the inside of the eye. It's very thin and filmy and delicate. It contains the rods and the cones. And it's responsible for all of your sight, central and peripheral. The macula is a very specialized area, very highly concentrated with cells that collect sight impulses, send them back to the brain. The size of the macula is very, very small. It's probably less than 1 millimeter or 2, about the size of a pencil point. All of the things that we're talking about go on within that very, very small area, but a very important area. And that's where macular degeneration occurs.